Well, hello, everybody. Good afternoon or good morning, depending on where you are in the country. My name is Garrett Schmidt, and I'm the CEO and managing editor of VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by Proficient Health, and it is called Addressing Patient Leakage in Value-Based Care Organizations. This is a very important topic and one that has plagued the industry for a long time, and I know that a lot of you out there are very interested to hear from our speakers today, who I will introduce momentarily. A few items of note before we get started, just some housekeeping items. Everyone is joined today in listen-only mode, so this is a traditional webinar format, so you don't need to worry about turning off your camera or your microphone. We can't hear you or see you. However, we do want to hear from you, so we're going to have time for some Q&A towards the end of the presentation, where we'll get to as many audience questions as we can. Now, if we're not able to get to yours, don't worry. Someone will reach out via email to make sure we answer your question afterwards. But at any time during the presentation, if you have a question for either of our speakers, go ahead and drop it into your attendee module. There's a little place for questions. And so if you drop those in, again, we're going to get to as many as we can. Also, the webinar today is being recorded. So when we're done, about, let's say, an hour or so after we conclude, you will receive an email, and there will be a link to where you can review the session, where you can download the slides. That way you can review it as needed or share it with your friends and colleagues. And we hope that you do. This is something we definitely want to get out there. So without further ado, wanted to very briefly introduce our speakers today. With us, we have Miss Erica Sapala, and she is the Director of Marketing with the Proficient Health. And then we also have Mr. Jeff Cohen, and he is an industry expert and consultant that is going to join us today. So welcome, you two.
Thank you, Garrett.
Awesome, Garrett. Thanks for having us.
All
All
right.
right. Well, hi, everyone. It's great to be here with you today. Like Garrett said, my name is Erica Sapala, Director of Marketing here at Proficient Health. I've been with the organization for just over 3 years, and I have about nearly a decade of experience working in healthcare technology. I'm really excited today for today's discussion addressing patient leakage in value-based care organizations. Joining me today is my colleague, Jeff Cohen. So Jeff has an extensive experience in strategic sourcing, supply chain consulting, and sales leadership. He's worked with major healthcare organizations like Vizient, Medline Industries, Healthline, and he now leads Side Street Ventures LLC, where he specializes in purchase services, consulting, and strategic sourcing. So welcome, Jeff.
Thanks, Erica. Really happy to be here and look forward to presenting on this understated and important topic of leakage.
Awesome. All right. So to kick things off, let's get to know our audience. So please take a moment to answer our first poll. What is your primary role in your organization?
Okay, and I'm going to chime in here real quick. So this should be on your screen. And so you want to go ahead and choose what best applies to you. Now, for all the polling questions today, they are anonymous, so you can feel free to participate and answer honestly. And we're going to show the results, so you'll be able to see where you stack among your colleagues. So we're going to give it another, I don't know, maybe 10, 15 seconds for the results to come in. Okay, and again, this is what is your primary role in your organization? Looks like most people have answered, so I'm going to go ahead and close it down here in 5, 4. Oh, see, now they're getting nervous. There's more results coming through. 3, 2, and 1, and I will go ahead and pull up the results. There we go. Jeff and Eric, are you able to see the results here?
We
We
are.
are. Thank you. Looks like we've got a wide, diverse group of folks, so appreciate all of you joining today.
Awesome. Thank you. Yeah, we'll have polls throughout the session today, and hopefully it'll lead to some good discussions here from Jeff. So let's go ahead and dive right into the heart of this topic. So, Jeff, patient leakage is something we hear about a lot. It can mean a lot of different things to different organizations. Can you just kind of kick things off, define patient leakage, and explain why it's such a critical issue in value-based care?
Yeah, thanks, Erica. And before I get into the topic of leakage, I just want to go back in history a little bit. It's very interesting from a health system perspective. Leakage has probably been a problem since health systems were created, but it really was something that was never on anybody's radar due to the way technology was back then. The way hospitals and health systems looked to save money, if you will, was to really reduce costs on their operating expense. For 20 some years, I've been extensively involved in healthcare consulting in one form or fashion. And really, up until just a few years ago, the vast majority of it was looking at how am I going to save money on services? How can I get a better rate on our waste disposal? Can I get a better price on a widget? Hips, knees, and screws. Can we reduce the cost of those implants so that we're making as much money as possible from the insurance companies? And things really shifted when value-based care sort of came to the forefront, in conjunction with the Affordable Care Act, back in the mid to late 2000s. And really since that time, the supply spend and the operating expense reduction has been still extremely important and really an easy way to help reduce costs for those hospitals and health systems. But that really hits a limit. And so health systems are really starting to identify, okay, we have a really good handle on our supply spend, but our revenues are declining. What can we do about it? And one of the things that really came out several years ago was this concept of leakage. And when we think about leakage, we're not talking about, the hose gets turned on and it's spraying everywhere and just money is falling everywhere. We're really talking more about, pinhole leaks. Like think about a slow leak in a tire. Over time, eventually it's going to become flat and you'll no longer be able to drive. If you think about that concept within the healthcare environment, if you don't get a handle on your leakage, your revenues are going to decline over time to the point that your expenses will outweigh your revenues, and that's not a good situation at all, especially in an industry where not-for-profit hospitals are operating at 1% margins, for example. But before we really get into what is leakage, I think it's important to understand a few things with regards to the overall costs of patient leakage. What happens? Healthcare today, healthcare spend in the United States is somewhere around $4.5 trillion, more than $13,500 per person. Healthcare executives report some of the following. 43% are reporting that they're losing 10% or more of their annual revenue to leakage. 19% are losing up to 20% of revenue due to leakage. And another 20% don't understand where or why patient leakage occurs. So they understand this is a serious problem. They're losing revenues, no clue why. The average hospital loses 10 to 30% of their revenue due to patient leakage. And that causes between $200 and $500 million in losses per year. So when we think about leakage, what is it, right? It's something that occurs when patients leave a provider's network to get care. And there's two types of leakage, and I'll give some examples of both. The first is voluntary leakage, where a patient willingly chooses providers for their own reasons. It could be quality of care, convenience, cost, or in many cases, patient experience, okay? The other type is involuntary leakage, where a healthcare system doesn't offer the types of services that those patients need. And so those patients are forced to look for care somewhere else due to things like lack of access, inadequate services, or providers that just aren't available. Personal story on leakage, how I became leakage, if you will. I went over the summer to my local health system to get a physical. And I'm going to be 50 years old next year. So I said, hey, I need to get a colonoscopy. I needed a dermatologist. I had some high blood pressure. I wanted to get with a cardiologist. And for one of those three, I was told to just go and Google a provider. Interesting. For the other two, a few days after my visit, I received a notification that I had some sort of message in my patient portal, and at some point I went in and looked at the portal, and for all three of those services, I went elsewhere. For the dermatologist, for the cardiologist, and for the colonoscopy. That healthcare system lost me for those services due to leakage, voluntary leakage. All right. So what happens is with this leakage, and it's very important to understand this, that when a patient leaves a network, the providers lose the patient data, which then limits the ability to effectively manage me, in that case, and my health. Or if I had a chronic condition, they lose track of that. Which leads to two types really of the leakage. One involves the healthcare systems at large, which is a revenue loss. And in the value-based care world, leakage is extremely important to the ACOs as well, because if, especially in a system-owned ACO, if that patient voluntarily leaves and either goes and gets those ancillary services done elsewhere, or don't do it at all, it could result in increased costs of care or episodes that cause that patient to go into the hospital. So why this is important is since ACOs prioritize population health management and the financial incentives to provider success, leakage poses a significant concern. ACOs must do all they can to keep the population inside their network, to have at a bare minimum visibility into the behavior of the population for which they're responsible. It's extremely important to stress that. Once a patient leaks, as I mentioned earlier, you no longer have insight into that data. You lose, quote, control over those patients, if you will, and really just you lose that relationship and you lose that understanding. But most importantly, you lose the revenue, especially if they leak out to a competing health system, which in turn could eventually receive all of their business when they do need hospital services. Or if they just go to independent specialists, those revenues are never able to come back. Typically leakage is not caused by clinical or quality failures, but rather what patient expectations are not met. And there's really four significant causes of patient leakage in healthcare. One is ineffective referral processes, or a poor handoff, if you will, lack of care coordination, patient preference for out-of-network providers, and lastly, technology and data gaps. And when we talk about ineffective referral processes, most practices out there still use outdated paper referrals or old technologies that rely on the patients making the next appointment themselves. I gave that personal example of I needed a referral. I was told to Google a dermatologist. I picked up the phone after looking around at different reviews. I made that referral myself. Or you get a message in your MyChart or something else that tells you to make the appointment. Nobody's helping you make those appointments. And a lot of health systems use call centers, but those call centers are typically only open during normal working hours when people are working. And it causes appointment scheduling delays and frustration on the patient's end, which in turn could cause that patient to look elsewhere, some other alternative means, like I mentioned, Google or social media, to find the services that they need. The second main reason I mentioned was lack of care coordinations. Most practices, most health systems are employee strapped, and so they're not set up to proactively communicate with patients. They do appointment confirmations. Most health systems are really good pinging you via text, email, calls that you have an appointment tomorrow. But they're not set up to answer questions. They're not set up to be proactive. And patients, like any kind of consumer for anything, they want to feel wanted or feel needed. And if you're not getting those personal touches, you're not getting that proactiveness, it's very difficult for that patient to think, I really like this health system. I want to do all my services with them. The third thing I mentioned was patient preference for out-of-network providers. If you are allowing your patients to go search for their own providers, talk to their friends, talk to their neighbors, talk to their relatives, there's a very high likelihood that those patients are going to leak. And lastly, and I'll get into this a little bit later, but technology or data gaps. The reason I think why leakage, which has been obviously a topic for many decades, hasn't really been addressed is because there was really no way data-wise or technology-wise to really get your arms around all of the information that's out there today that you can acquire through claims history, through predictive analytics, through payer information to understand, Jeff Cohen is a patient at healthcare system ABC, and I had $2,000 worth of spend, but looking at payer information and claims history, that I had $15,000 of spend elsewhere. Why was it elsewhere? Where did it go? There's technology available today. There's data available today that, if used correctly, can really make a difference with that. So what are some consequences of leakage? Well, one is revenue and market share declines. Clear lost opportunity for more revenue from potential visits and procedures within that own health system or within that physician group or within that ACO. That is the biggest revenue loss for providers. 60% of all hospital and health system revenue comes from outpatient and physician practices, and getting a patient into their PCP, letting them know through an annual wellness visit or some other type of visit that they need to see 3 other specialists, but leaving that up to the patient really can put a strain on hospital revenues and that hospitals and health systems market share in their area. Underutilization of services. When patient volume is lost at a high percentage, it can result in underutilization of existing healthcare infrastructure, such as equipment and staff, which in turn over time can cause reductions in force, layoffs, equipment to be taken off of lease, no longer available, which would force patients to have to go somewhere else as well. Third is compromised care coordination. As patients are separated across competing health systems, their data, the patient's data, their treatment plans, and their care teams become fragmented. And that really can raise some concerns about patient safety, treatment errors, and substandard health outcomes. When you allow a patient to leak, there's a much higher likelihood that they have an episode that causes them to be hospitalized versus keeping them in your health system and being preventative with that care and being proactive to ensure that their care is not compromised. And lastly, really it's something simple, patient displeasure. There's a reason that people voluntarily leak. We talked a little bit about it earlier. And in some ways, it shows that the original provider failed to meet the expectations of that patient. I went to the doctor. They told me to Google a provider. So all of these things create consequences with regard to leakage. We're going to talk a little bit here in a few minutes about strategies to reduce patient leakage. We're going to talk about improving referral processes and care coordination to help with leakage. And then lastly, trends and future insights. So Erica, I'm going to turn it back to you for a few.
Awesome. Thank you, Jeff. That was super helpful to get a good foundation, especially for the rest of this conversation. Let's kind of hear from our audience. So we'll do our next poll. What do you think is the most significant cause of patient leakage in your organization? And because I know we probably have a few vendors on the call, if you want to select this in the mindset of the people you work with, you can do that as well. I think that's totally fine.
All right, you will see it up on your screen if any of you are just joining us. These polling questions are anonymous, so feel free to answer and participate, and we're going to show the results so you can see where you stack among your colleagues and what everyone else is feeling as well. And we're going to give it a few more seconds for everyone to answer. And again, what do you think is the most significant cause of patient leakage in your organization? Or to Erica's point, in maybe your clients' organizations. Okay, and looks like the majority of the results have come in. So we're going to give it about 10 more long seconds and then we'll close it down and show the results. Okay, and we'll close it down in 5, 4, 3, 2, and 1. Here we go. Share the results here. Okay. Erica and Jeff, are you able to see the results here?
Yes. All right. Well, that is super interesting, Jeff. I'm curious if this is what you thought it was going to be. Anything stand
Yeah,
out
no,
to
I mean,
you?
it does reflect some market and industry trends. I'm a little bit surprised at the 11% for the technology and data gaps. Maybe with some of the things I'm going to talk about later, that if we redid this poll question, it might change. But um, clearly, care coordination is a big issue within both healthcare systems and value-based care ACOs. Uh, Ineffective referral processes, clearly based off some of the things I described. I think that probably resonated with some of the folks. Patient preference. We'll talk about ways to limit that within a health system or an ACO, and then the technology and data gaps. So not too surprised, but I knew there would not be one category that was shut out, to say the least.
Yeah, for sure. All right, let's move on to segment number two, strategies to reduce patient leakage. So now that we understand the problem, let's talk about solutions. So Jeff, what kind of strategies have you seen that have effectively reduced patient leakage?
Yeah, awesome. So what we're going to really hit on in this section is strategies around enhancing care coordination and referral management, using technology for better communication and transparency, and educating patients about in-network benefits. Interestingly, the poll was talking about preference for out-of-network. There's some strategies around that, but I think it's important before we dive into these strategies, uh, in order to understand how the strategies will reduce patient leakage, we really need to understand how to identify leakage. We talked a lot about what leakage is, and where it comes from and how it affects the financials of a hospital or healthcare system or an ACO. But how can organizations identify leakage? And once we identify those, and I've got a few talking points around those, then we'll get back to these three very important topics around the strategies to reduce patient leakage. The first really is you can identify leakage through claims data. Claims data is truly the only way to know for sure beyond internal health system or ACO data. Um, the only way to know for sure about leakage is to tap into the claims data. You can clearly see where patients are going, which providers they're using, and what systems they're going to if it's outside of your own. And a lot of CMS data, it's publicly available. It's not typically in real time, as you all know, but you can do some retrospective look backs, 90 days, 120 days, however far you want to go back, and really key in on your patient mix and see, now, like I mentioned earlier, if I'm $2,000 at health system A, but my overall spend was 15,000, wouldn't you really like to know where that money was spent and where I was spending my time outside of that health system? So claims data is huge around that. Patient journey, another extremely important way to identify leakage. Leakage can really occur at any point in time from that patient journey. Um, from the initial visit to the referral to the intake to the billing process and beyond, understanding where the leakage is occurring in the patient journey can really bring everybody back to that certain point. And it's going to be different in a lot of health systems and ACOs and other value-based care organizations. I would say the bulk of it is going to be post that annual wellness visit, that PCP visit, where they're getting referrals to all of their specialists. And when I say referrals, referrals is a very loose term, because if you're, a traditional Medicare patient, you don't actually need a referral to go to these specialists, but a recommendation to go, we just typically call it a referral. So really understanding where in that patient journey that's taking place, you can really nail down and pinpoint that. Data analytics, very, similarly to claims data, another effective way to discover where a healthcare organization is losing revenue from with regard to leakage is to evaluate current data in relation to previous performance. If nothing else, if you're not going to look at claims data and you're only going to rely on your own health system data, you can clearly plot point in times to say, okay, this cardiology practice in this last 12-month period produced a revenue basis of $100 million, and it had 2,000 patients, and it had the same 2,000 patients in the other 12 months and prior to, and it was, $200 million. Well, there's a big problem there. So you can really get to the core of where that leakage is occurring by analyzing your own data. And then if you take it a step further with the claims data that I mentioned, you can really pinpoint to a T where you can do that. It's very difficult to do manually, and this is why a lot of health systems do not do it, but there's a number of data analytic companies out there that do a lot of predictive analytics, and they can really dig into that data to let you know where that data, where your gaps are with regard to leakage. And we'll talk a little bit about that a little bit later. And one of the last ways to identify leakage is really looking at referral patterns. Use that data to see where patients are going. 94% of all health systems and value-based care organizations know that they have a problem with leakage. Interestingly enough, with that is 90% of these systems and value-based care organizations, they don't have confidence in their ability to track the leakage. So we know there's a problem, we know there's a solution, but we don't trust what we have internally. So understanding now how to track leakage, then we can kind of talk about some of these strategies around ways to reduce leakage. So when we talk about enhancing care coordination and referral management, what are we talking about here? Capturing that patient, having that patient journey begin, move forward and end with that health system. And how do you do that? Well, the first way is to really enlist a strong referral management program. And there's a number of platforms out there like Proficient Health that has a very robust way of streamlining that referral management and using the data inside of that platform to work with care coordinators to, one, ensure that referrals are being acted upon from start to finish. When was the referral sent? Was it acted upon by that specialist? And has that patient been to the doctor for that particular specialist visit? With a simple, easy to use, robust platform, that's one way to really reduce the leakage. And what that can do then from the care coordination side is give those care coordinators or referral managers or whatever you want to call them within your health system, you're arming them with the information to make the phone calls. You don't need to call every single patient. You'll get the information in real time to see, okay, Erica was given a referral on December 1st. It's December 17th. She hasn't been to the doctor. She hasn't even scheduled the appointment. We need to give her a call. So that's one way to do it. Leveraging technology to improve communication and transparency. That's what I mentioned earlier. There are so many wonderful companies out there on the data analytics side. A couple that come to top of mind, a company called OpMyCare. There's a company called HDAI. They really take that claims data. They really can do predictive analytics. Who's leaking? Why are they leaking? Who's a candidate to leak? Who are the high flyers? All of the indicators for a care coordination team to reach out and be proactive with their patients. And, so many people go to their annual wellness visit and they're never seen or heard from again. And because they don't follow up and they don't go to their secondary appointments. A lot of things can happen as people age. They end up in the hospital, and spends continue to go up. There's a lot of data analytic companies, like I mentioned, that can really do a good job of helping you get your arms around that data. And anybody can feel free after this to reach out, and I can help get you in touch with some of those companies, both on the referral management side and on the data analytics side. Lastly, educating patients about in-network benefits. This is something that, as a consumer, we're all consumers. We're all getting inundated with information all the time. We don't want to get too much, but we don't want to have too little. How many times have you Googled a car, for example, and then every time you open up your phone, you're seeing an advertisement for whatever car you just looked at? That can be a little bit overbearing. So you certainly don't want to give these patients too much information. But what's happening is they're not getting enough information. People want to be pinged. People want to feel liked. People want to feel loved. And if you're being proactively reached out to with not just, hey, schedule your appointment, but a simple email highlighting whatever's going on in that particular month. So this month we want to highlight cardiology. And, if you're prone for X, Y, and Z, call and schedule appointment. People will think about that. And if you're not doing it, if your health system's not doing it, if your ACO is not doing it, somebody else is. And so the only way to ensure that is really just to highlight your organization, what you do well, what your outcomes are. You've got A+ rated physicians, A+ rated providers, A+ rated surgeons. Highlight those people. Give them a reason to want to go to these people. Like I said earlier, people really lean on their network and which includes coworkers, peers, friends, and family, and they take that advice seriously. So you, as a health system or as an ACO, you need to become part of that network for these individuals, and really become center stage with that. So those are some 3 really good, strong strategies to help reduce patient leakage.
Awesome. Okay, let's go ahead, and what we're going to do is hear from our audience again, and we're going to do another poll. So we just heard from Jeff, and so now let's kind of hear from you guys. Which of the following interventions would have the most impact on reducing leakage in your organization? And then, of course, if we had some people join in late, if you're a vendor, an other, if you will, you can just answer on behalf of the people you work with, so clients.
Okay. And just as before, you should see this up on your screen. So go ahead and answer which one best matches, and then we will give it a few seconds for people to answer, and we'll show everyone the results. Okay. Give it about 10 more seconds, and then we'll close it down. All right, I think most of the results have come in at this point, so I'm going to close it down in another 5, 4, 3, 2, and 1. Okay.
All right, Jeff, I don't think any of this looks surprising to me. Does this look
No,
right
I
on par
think
with what you were thinking?
referral, and
Yeah.
shameless plug. Proficient Health has a very robust referral management platform, that they can tell you all about. Reach out to me afterwards. I'm happy to bring it up. But yeah, it's the most important in my estimation, and in talking to people who run health systems, people who run ACOs. Referral tracking is really the biggest way to control your patient flow and keep that patient's journey within your health system or within your ACO. Not to take anything away from the others, but that is certainly the biggie here.
All right, well, that's going to bring us right into segment number 3. So 42% of you said referrals was a big concern. So obviously referrals seem to be a big leakage point. Jeff, What are some best practices for closing referral loops and keeping patients within the network?
Yeah, so I'll get to that here in just a second. I really found some interesting patient referral leakage stats that I wanted to share with you all. Nearly 20 million clinically inappropriate referrals occur each year. Um, and really the reason why is because providers, referring offices, and call centers lack information about the specialists to whom they are referring patients. Um, as I mentioned earlier, my own health system told me to Google a dermatologist. I know I've used that example 5 times, but it occurs over and over and over, not understanding who to send people to, which is why, and I'll get to it, the referral management platform, like the one Proficient has, really can ensure that this information about these specialists is provided at time of service in real time and can be scheduled and acted upon. Um, 79% of healthcare providers think in-network is important, but at the same time, 8 in 10 providers still refer out of network. So one way to control the leakage there is to control those referrals and don't allow those providers to have that option. Uh, 55 to 65% of referrals are sent out of network. We talked a lot about that earlier, that's contributing to that $200 to $500 million annually lost. And these are coming from providers within the same healthcare system or the same value-based care organization. 55 to 65% of referrals are sent out of network. Those costs equate to about $800,000 to $950,000 per provider. So if you're with a health system or you're with an ACO, it's very simple math. Take 800 to 950,000 times all of the specialists that are working for your or all your PCPs that are working for your organization, and that's what your leakage is going to be without really any deep data dives. Um, Another staggering statistic with regard to referral leakage statistics, 40% of health systems don't know or track how much revenue they're losing. Like I said in the outset, everybody knows this is a problem, but they don't do much about it. So when we talk about improving your referral processes, there are several benefits of controlling patient referral leakage. A lot of these we've already talked about with a lot of these statistics and things like that. But some of these are really a reason why, if you don't have a robust referral management platform today, it's something that you should seriously consider. I get a lot of, in true transparency, I consult for a number of different organizations and companies and things like that. And so I'm in front of healthcare executives all the time. And when I bring up referral management and a referral management platform and the benefits of it and so on and so forth, I constantly get, oh, well, Epic already does that. Or Cerner already does that. Or, XYZ EHR already does that. They do exactly what I described as a patient, right? They allow me to make an appointment on my own. They don't make appointments for me. They make recommendations for me. And so combining a referral management platform with an EHR is for a health system, and an ACO for that matter, is really a home run with regard to helping to control leakage. So, benefits of controlling patient referral leakage: you're improving revenue by keeping customers in network and creating patients for life. That's how do you ensure that patients don't veer off and go see other providers elsewhere? Keep them happy, keep them customers. How do you do that? With a referral management platform, those referrals are provided at time of service from that PCP. You as a health system can load up that platform, or if you're an ACO, you can load it up with only your own providers if you're a health system, or if you're an ACO and you have preferred providers, you've got really high performing specialists that really control costs, then you can load up your PCPs with cardiologists or rheumatologists that you choose. You're taking the choice away and you're keeping those patients in network, so to speak. It's 6 to 7 times more costly to acquire new customers, new patients than retaining existing ones. Think about that. Every patient you lose, it's going to cost you 6 to 7 times more to obtain new ones. You have these patients. You have great providers. Keep them in that continuum of care. You can avoid out-of-network referrals, which creates opportunities for competitors. Again, you control the leakage by limiting those opportunities. I just mentioned the whole continuum of care, providing better quality of care by keeping patients in your continuum. I can't stress that enough, and that goes back again to what we talked about. Keeping them in network keeps these patients with you, with your health system, with your ACO for life. If an ACO with a PCP that has 2,000 lives, 25% of those are not attributed to that physician, but for the spend. If you can't control those referrals and they have an episode of care that ends up spiking their costs, you could lose that patient to another ACO. So it's all about the continuum of care. It's all about taking care of patients. And it allows that data to be shared within your system. So along with the referral management platform, enabling and working with some of these predictive analytic companies can really highlight, again, where's the leakage coming from? What's it costing? Who are our potential high flyers? And again, to really, through the referral management, through the care coordination, through the data platforms, you can utilize your care coordinators to ensure that you're addressing any issues before they come up. You're keeping that revenue within your health system. You're keeping the costs low so that you're hitting your ACO shared savings number and providing and adding benefit to both your patients and to the providers in that system. Back to you, Erica.
Awesome. Thanks, Jeff. This is kind of perfect transition here. We're going to hear from our audience one last time, and hopefully we'll save enough questions to hear from you again with some questions at the end. So let's end with our last poll. What are your organization's biggest challenges in addressing patient leakage?
All right, just like before, it should be up on your screen now, so just choose the one that most applies. We will show the results. What are your organization's biggest challenges in addressing patient leakage? And again, if that doesn't directly apply to you, then maybe your clients or colleagues. We'll give it another 10 seconds or so for people to answer. Okay, I think most of the results at this point have come in, so we're going to go ahead and close it down in 5, 4, 3, 2, and 1. And here are the results.
So I had a feeling that it would be limited resources and staffing. That we hear all the time. And what we've seen is health systems and ACOs that have adopted, at a minimum, a referral management platform have really been able to utilize their current staff, taking that data, the real-time data that comes out of that platform, to connect with the patients that need to be connected with the most, and understanding who to connect with can be done with limited resources and staffing. By having these platforms or utilizing some of these predictive analytic companies, you don't actually have to add staff. In many cases, you could utilize the same staff or have less staff because these programs really do a lot of the work for you. because it really pinpoints and hones in on exactly where my issues are and how to address them. So figure that would be the answer. And there's definitely some tools and resources out there that we would love to tell you about if you're interested.
Yeah, perfectly said, Jeff. So, healthcare is always evolving. So, let's round things out. This is our last segment here. So, Jeff, what trends or innovations do you see shaping how organizations address patient leakage in the future?
I think what I'm reading in the tea leaves and some of my conversations that I'm having, um, there's really four areas that are really being addressed. One is that whole limited resources and staffing. Health systems are starting to understand that um, you can't recapture revenue if you can't put the time in to do that. And so a lot of health systems are really putting more effort into their referral managers, care coordinators, whatever title you want to give these folks, patient outreach, to really make sure that patients are scheduling their visits, that they're going to see their specialists that they need to go see, that they're keeping up with their annual wellness visits. And really, the main way to do that is, again, through a referral management platform utilizing um, predictive analytic data companies. And so, money that would have been spent on some other things is now moving into this area. As I mentioned at the top, healthcare really just used to be all about, okay, well, how do I reduce my operating expense? And you can only squeeze so much out of that. You're not going to take that spend down to zero. You still need supplies. You still need equipment. You still need all of buildings, all of these different things. So how do you offset the rise in operating expense? It's strictly by increasing patient revenue coming into these organizations, and so they're really starting to build out or utilize a third party for these types of activities. A lot of healthcare systems specifically used to, in many ways, let the inmates run the asylum, so to speak. You didn't want to upset the physicians, you didn't want to upset clinical managers, but now we're at a crossroads in healthcare where if you don't adopt some of these newer methods, technologies, products, you may not be open in a year or two. And so the whole resistance to change, I don't want to upset so and so, that's really been taken off the table. And the healthcare systems and value based care organizations that have really been able to do a really good job at addressing leakage and increasing those revenues that occur from minimizing leakage, they've told their folks, this is how this is going to be. And if you're not on board, then maybe you need to find somewhere else. And people that are resistant to change also really don't want to go anywhere else, and so they kind of to jump on board. Um, Data is going to be king from now until eternity. There's so much out there with claims history, payer history, artificial intelligence, ways to mine data. You can get things so much faster. So having that data and spending the money to find people that understand what to do with it is really going to be paramount as well.
Awesome, Jeff. Well, thank you so much for this fantastic discussion. We really enjoyed having you here with us today.
Appreciate being here. Yep, thank you
Yeah,
very much.
so I think we have about 10 minutes, exactly 10 minutes. That's genius.
Right.
We'll pass it over to Garrett, who I think is going to facilitate some questions from the audience.
Wonderful. Yes. And we do have some questions that came in. If you have a question that you would like to ask either Jeff or Erica, go ahead and drop that in now to your control module. You got to place 4 questions specifically. And we're going to get to as many as we can here. Starting with this one, what are some early signs that patient leakage might be becoming a problem, and how can we stay ahead of it?
So as I mentioned, the easiest way to really get on top of it now is to really look at where your volumes are coming from today, specifically in the specialty space. How many patients were seen in the last 12 months? What was those revenues versus a prior, whatever time period you want to look at. If you're seeing a similar number of patients with a lowering of those revenues, there's a problem there. If you're seeing the number of patients drop versus what you're seeing year over year, 3-year lookbacks are typically the best to doing data points to look at, and that can really tell you a lot. So I would say that's the first place. If I were running an organization and I really wanted to identify leakage, I would look at internal data.
Very good. Next question here is, how do we encourage patients to stay within our network without making them feel like they don't have a choice?
Again, as I mentioned earlier, it's the soft touches. It's the thank you. It's the thank you notes for coming to your appointment. A lot of successful health systems, large physician groups, ACOs, they send out weekly or monthly newsletters highlighting certain things, um, subtle reminders about annual wellness visits long before they actually need to have it. A lot of organizations wait until they, hey, Mr. Jones, you were supposed to come in for your wellness visit, and it's after the fact. So it's subtle, soft, proactive touches.
Great. Next question here is, are there any specific tools or technologies that have really helped reduce patient leakage and improve referrals?
Absolutely. A referral management platform such as Proficient Health is really the first and best way to start. And I also mentioned a lot of these predictive analytic data companies, and actually you can combine the two to really pinpoint where my leakage is coming from, who are my leakers, and that way you can stay ahead of it by getting in touch with those folks to ensure that they're following through with whatever visits they need to take place.
Great. Don't be a leaker.
That's right.
All right. Uh, okay. Next question here is, what are some of the biggest challenges in getting different providers to coordinate care, and how can we make it better?
Yeah, I mean, I think that's one of those is really getting the providers within the health system on board with the whole system mentality. Just like as patients, we reach out to friends and family of, what ortho should we go see for my knee replacement, or, whatever the specialty is that you need. Doctors, providers, they're no different. They have friends and colleagues all over the city or wherever they're at that work in different healthcare systems. But if you're an employed physician, or you're with an ACO, it's really important that the message is delivered to those providers of, here's why it's important that we utilize our own providers. And it goes back to that whole, if you're not referring within your own system, they're going elsewhere, and that's money that walks out the door that will never come back. So again, healthcare is changing significantly. It's very hard to make a profit anymore as a whole, as a health system. And so really anything you can do to highlight the value of your own organization really will go a long way with those providers.
Yeah, that's a great point. All right. Next question here is, and I'm sure this will apply to a lot of you out there, is how can smaller healthcare organizations tackle patient leakage when they don't have a big budgets or a lot of resources?
I would say a referral management platform would be the easiest way to tackle the leakage. It's extremely efficient and cost effective on a per provider basis. It doesn't require a lot of extra hands on deck, so to speak. And you can usually work within the existing infrastructure of the folks that you have with your group to ensure that patients are being reached out to and touched, and to ensure that they're following up on those referrals and following through with the appointments.
Very good. Very good. All right. Well, that actually concludes our audience questions. If you have one as we're closing out here, please go ahead and drop it in, and somebody will reach out via email to make sure we get you an answer. But wanted to thank you, Jeff, and you, Erica, for a fantastic presentation. There's obviously a lot here, and for those of you out there, we're going to be sending you a link. When we're done here, and you'll receive a link to the recording as well as to the slides that were used today. But as we close out, I wanted to encourage you all to head over to vbcexhibithall.com, and there you will find a virtual exhibit booth for Proficient Health. And there you can read up on them and really educate yourself on what they're doing and some of their solutions and if they can be of help. And of course, there's ways that through there that you can reach out to them directly. But if you would like to reach out to the Proficient Health team, feel free to do so. And their information is here. You can reach out to them at the website, or feel free to reach out to me as well. And I'm happy to facilitate an introduction to the right person for you. So, wanted to thank you all again so much for joining us today, for spending your afternoon with us. I hope you will join us on the next one and enjoy your holiday season. So, thank you so much, and have a great one. Bye bye now.
Thank you.
Thanks, guys.